while we're waiting for some questions to come in, I wanted to just ask you a little bit about, you had 2 cases there where you utilized the Dreal in cases preparing for coFlex. And I was just going to see if there were any other comments you could provide on, how it helped you prepare for that device, but yet maintain, to get that thorough decompression, but yet maintain enough bone to support the coFlex device itself.
Yeah, that's a good point. If you, the folks listening and watching, if you've done a coFlex, you have to preserve the spinous processes. And the trick is taking out the interspinous ligament and fashioning that slot between the spinous processes. And then what I run into frequently, particularly going cephalad, getting under that superior or the inferior ledge of the superior vertebral lamina. And I've started using the Dreal to get that started. And now I'm actually reaching up and under the spinous process and thinning out the ligamentum flavum and taking down bone. Whereas before, you take that away with a Kerrison, you start nipping up there, and maybe you take too much, maybe you break the spinous process off. And for the coFlex procedure, I use this thing on every case. It is just handy. Once you get used to using it, you will just start reaching for it to do things that you wouldn't have dreamed with until you've actually had this thing in your hands. I don't want to promote any off-label uses, but thinning down the lamina from underneath, the angle is perfect. The way the tip is angled and the way it's shielded is perfect. And so I'm very grateful. So far, in my experience, I've not had a single dural tear. I probably just jinxed myself, but it's been very safe in my hands.